I'm Julie Zenner, and here's what's coming up on Almanac North. The number of COVID-19 cases is spiking in Minnesota and Wisconsin. Death totals are rising, and local hospitals may soon reach capacity. Hear from local veterans about the importance of Veterans Day and how vets are coping with isolation during the pandemic. And St. Louis County's DWI Court is persevering despite challenges brought on by the coronavirus. It's all coming up next on Almanac North. Hello and welcome to Almanac North. Thanks for watching. Dennis is off this week as we alternate hosting during the pandemic. Our show is recorded on Thursday afternoon. COVID-19 is once again dominating the headlines as Minnesota and Wisconsin both recorded their largest increases in cases and deaths this week. Governors in both states issued executive orders aimed at reducing the spread of COVID. More on the pandemic in a moment. Duluth Public Schools announced some changes this week due to the rise in COVID cases. Starting next Thursday, elementary schools will move from a hybrid schedule to entirely distance learning. And high school athletics and other in-person activities will be suspended beginning next Wednesday. Superior Street in downtown Duluth is scheduled to reopen to traffic on Monday as work wraps up for the season. The major rebuild of Duluth's downtown artery replaced the old bricked street and provides many new amenities. About 6 to 8 weeks of work remain to be done on Superior Street next summer. And United States Steel has announced it is restarting its Keetac facility in Keewatin by mid-December. The plant has been idled since May due to a lack of demand for steel brought on by the pandemic. U.S. Steel is calling nearly 400 employees back to work, meaning all 6 Iron Range mining facilities will soon be back in production. But now turning back to our top story of the week, a feared second wave of the COVID-19 pandemic is striking the Midwest. Hospitals in the region report 90% occupancy or higher, and many hospital workers are falling ill with the virus, further stretching resources. Joining us now with an update on this critical problem is Dr. David HERMAN, CEO of the ESSENTIA Health System, and Dr. Andrew Thompson is an infectious disease specialist with St. Luke's Hospital. And doctors, thank you both for being with us. We really appreciate you coming in during this challenging time for your facilities and for yourselves. Dr. HERMAN, let's start with you. How is ESSENTIA and its facilities doing right now in terms of the coronavirus and addressing the current surge?
We are very busy. We are very busy with patients with coronavirus in regular hospital beds and in the ICU. And of course, the ordinary burden of illness continues here as well. So we're seeing patients with strokes, heart attacks, trauma as well. We are incredibly busy.
And what about you, Dr. Thompson?
We're having the same issues that ESSENTIA is. Really, for the past month or so, we've been quite busy just with typically ill patients, patients who may have deferred care from earlier in the year, but we've been busy. On top of that, we're seeing a significant increase in numbers of COVID patients. And as you mentioned earlier, we're finding ourselves in some departments short-staffed due to staff becoming ill as well.
Is that the case at ESSENTIA too?
Yes, it is. And the challenge that we have is that staff are contracting the virus or being exposed to the virus within the community. So today we had more than 400 care providers just here in the east part of ESSENTIA that were unavailable to work in their clinical activities.
Good or bad, a lot of people are skeptical of COVID-19 and of the numbers. People hear about record numbers of patients hospitalized with COVID. Are the folks within that number actually hospitalized due to COVID, or is it a situation where people come in for other things, they are diagnosed with COVID, and then they fall into that category?
No, these are patients that were diagnosed with COVID, usually by a COVID test and an illness outside of the hospital setting, have been managed at outpatients for a while, but now have gotten seriously ill and end up being in the hospital.
We have one ICU completely devoted to COVID patients. These are patients on breathing machines. They're critically ill. So COVID patients are admitted to the hospital to care for their COVID illness. It is very real. If you saw what I see on a daily basis, you wouldn't doubt it.
So your opinion that it's not, the spike is not due to increased testing, it's actually due to more people getting ill with COVID?
Yes, it's due to more people getting ill. Even with the increased testing, the number of patients testing positive is incredibly high. But as Dr. Thompson said, on the regular hospital beds and in the ICU beds, we're seeing more COVID patients than we've seen before.
Dr. Thompson, with so much stress on the capacity at St. Luke's and all the facilities around here, what should people do if they think that they have COVID? Should they show up at the emergency room? Should they come in to their doctor? What's your recommendation?
Good question. People should get tested. If they feel ill, they should seek out care. They may want to call their primary doctor to get guidance. At St. Luke's, we have a respiratory illness clinic. So if people are concerned and they have symptoms, they could go to that clinic up at Miller Creek. I know Essentia has the same. And there's also testing available in the community. People may be aware that at the deck in Duluth here, there's free testing for all Minnesotans. So if people are concerned that they've been exposed or that they're ill, they should get tested. And once they're tested, they should isolate until they have that result. That's a critical part of it. It's not just getting tested, it's also protecting everyone around you.
Dr. Herman, why do you think the spike is occurring right now? Is it because more people are indoors and their gatherings are indoors, or what do you attribute that to?
I think so. There's a lot of different reasons. First of all, we are indoors more often than we were. I also think our behaviors have changed over the last several months. There's a thing called pandemic fatigue. You just get tired of that. We're all human. We like to be in contact with others. Schools have started back up. Our young people have gone back to the universities and back to schools. I just don't think we're doing as good a job as we did in the summer, masking, staying away from each other, and avoiding gatherings.
Any best practices that you would recommend for people as we head into the winter season and as we head into the holidays when so many people get together?
I agree with Dr. Herman. We're tired. We're fatigued. You know, we, as in Minnesota, starting in March, we really buckled down in the springtime, and I think we prevented a lot of illness. It's hard to see that because we prevented it. We have to keep doing those things that we did back in the spring. We have to mask. We have to avoid gatherings. We have to really not be unmasked except around people in your household, unless you're at a significant distance from them. Those are the key factors to prevent transmission.
Governors in both Minnesota and Wisconsin have issued mandates and/or recommendations as we head into the holidays. Do you think that's a solid step at this point in time?
I would say the approaches that both governors have taken have been very data-driven approaches. We know where people get the virus. We know how they spread it. And so the recommendations that they've made and the rulings that they've made should help in helping tamp this down.
How optimistic are you as healthcare professionals that this is going to be gotten under control pretty soon? We had Pfizer come out earlier this week with an announcement that there's a vaccine that has apparently a 90% success rate. Do you see this as a good sign within the next year that we might have this under control?
I think you've got the time frame pretty much right. We know that the allocation that the state of Minnesota is going to get for the first vaccine is about 100,000 vaccines. And there's a group in the state that's working towards how those vaccines will be allocated. I think everybody in the region right now has an opportunity to be a healthcare hero. And that's by doing, as Dr. Thompson said, masking, avoiding gatherings, and I would add, get your flu shot.
And what about you in terms of your optimism for the future?
I'm not optimistic about the next few months. It's going to be very difficult. It's going to be difficult for all of us, for healthcare workers. It's going to be really hard on families. It's going to be hard to miss those holidays, to miss Thanksgiving and Christmas and New Year's. But I think in the long term, in the next 6 to 12 months, we have a lot of tools that are going to help us get this under control. I think there's light at the end of the tunnel, but the tunnel is still long.
We have about 15 seconds left, so strongest argument right now? What do you want to get out to people?
Wear your mask, maintain that social distance. This is an opportunity for us to use our behaviors to get this under control. We can't wait for the vaccine.
Mm-hmm. Dr. Herman, Dr. Thompson.
Do all of those things, and remember, it's to protect those people around you, your loved ones, your community, your neighbors. Let's all get through this safely.
All right. Thank you for the good advice, and thank you for the work that you and your crews are doing to keep everybody safe.
Thank you very much.
The Bong Veterans Historical Center and American Legion Post 435 did not let the pandemic stop them from honoring our nation's veterans. They held a flag-raising ceremony at the Bong Center in Superior on Wednesday. We spoke with the center's executive director and some veterans about how the pandemic has impacted those who have served our country.
I'm Dustin Heckman. I'm the Executive Director of the Richard I. Bong Veterans Historical Center. We held a Veterans Day ceremony this week in conjunction with the American Legion Post 435 to honor Veterans Day. With the pandemic, so many things going on, we felt it was important to still honor that day and do something rather than just let the holiday pass without any reference to it. So we were able to hold a flag of remembrance ceremony that really was respectful and honoring of our veterans. I think the biggest thing that we've seen with how it's impacted veterans is some of that isolation factor. When we shut down in March for 2.5 months, we were used to seeing our veteran volunteers every day, and every day on this day of the week we'd see this certain person. And going, that 2.5 months, it was really hard for us, even as staff, not to see our veterans. We see it with a lot of our vets that, they still they feel, isolated and alone. And sometimes we have some of our volunteers that just come in, not at their normal scheduled time just because they want to be around other people. And so, that's been for us a big deal to, how can we help to remove that isolation factor? And, how can we be part of that solution so that way they don't feel so alone and get some of that social interaction that they need to, just keep themselves going. Now being a veteran myself, it may seem odd to be in a veterans museum, but I actually married into a military family. So you have a great appreciation for that and understand what it's like for a deployed family to have that distance and miss some of those it's all right. The deployments and everything with my family, that's just kind of, it hits me every once in a while, so.
My name's Paul Pedersen. I work for the Minnesota Assistance Council for Veterans. I'm a senior case manager there at our Duluth office. I am a veteran myself. I've served 27 years in the 148th Fighter Wing and retired in 2016. Our mission is to help end veteran homelessness, but we can also help prevent veterans from losing their homes. There's a lot of things that are happening now, especially under COVID, that where there's eviction moratoriums, people are not allowed to be evicted due to non-payment of rent. So we're still trying to help keep their rent paid, keep them employed, make sure that they've got the right benefits, and if they're due more benefits, to help connect them to the resources that they can apply for those benefits for their services that they've earned in their military careers. So connecting them to the county veteran service officers to see if they're eligible for benefits either through disability or other types. During these hard times, every little bit helps. We're finding a lot of mental health issues, so we're utilizing the VA and other resources to make referrals to and connect those folks to that so you can get the help that you need and find that housing that you need and enjoy it. So some of the challenges that we may see with some of our clients as well as anybody during this pandemic is the isolation. When you can't either have guests over or go, it's not safe to go out, you want to make sure you have contact. You want to be connected with people. I think the whole world has learned about Zoom and Skype and all of these other virtual connections. And a lot of times folks are getting engaged with that. But if you don't have access to that, the homeless don't have iPads necessarily, you know, your social interaction is important.
I'm Dave Bowe. I served in the military from 1983 until 2006. I'm a 20-year veteran. I'm currently residing at Bayshore Rehab and Rehabilitation Center at Park Point. I've been here for about 2 years. It's just a temporary stay. And before COVID, I had pretty much free rein to move around, and I did a lot of biking and walking and going around. But since COVID, I've been kind of pretty much stuck here. But like I have told people, and I've written about it, that it's not a huge deal for me. Basically, due to my military experience. I mean, granted, that was a long time ago, but it kind of sticks with you. We've been through worse. I've had to wear my military gas mask. I've had to wear that for hours on end. And, you know, that was part of the job when you're in the military. And so now if I have to wear a mask, it's not a big deal. My stress is more geared towards my loved ones. My children, I have 2 sons in the military. They're going through their own dealing with the pandemic as they serve in the military. My situation is, of course, is a little bit more unique, but the way I think about it sometimes is, you know, I tell people, you know, I could be in a small pup tent in the middle of the desert in Iraq. But instead, I'm in a nice room and I'm okay. So.
The Richard I. Bong Veterans Historical Center will do its annual Thanksgiving meal for veterans, but a little differently due to the pandemic. They will be offering curbside pickup for veterans and delivery to a limited area. The pandemic has changed the way many of us go about our day-to-day lives. The court system is no different, as COVID-19 has forced our legal system to make adjustments. Through these difficult times, the St. Louis County DWI Court has continued to provide resources for people struggling with addiction. Joining us now is District Court Judge SHAUN, recently honored for his work with the DWI Court, and Tina Soberness is the Chief Executive Officer with the Center for Alcohol and Drug Treatment. And welcome. Thanks for being here, and congratulations, Judge.
Thanks for having me. I thought only my mom would learn about it.
Well, we'll be talking about
that.
We'll be talking about the award in a little bit. But first, for people who are not familiar with the DWI Court, what makes it unique, and how is it different from other court experiences that people might have?
Yeah, so it falls into the group called treatment courts. Started in Miami-Dade County more than 30 years ago, and it's organized around this idea that you hold people accountable and you resource them. You take a look at addiction, mental health, housing, whatever the issues are that present. If you can help people problem solve and get their life back on track, they're not going to come back. So it's this idea of intensive work, intensive resourcing, a team of folks trying to help people find the path and make it forward. Been really successful. It's the most, treatment courts are the most proven, effective method of intervention in the criminal justice system.
Are the elements of the team pretty much the same for every case, or is it all customized to what a person's needs might be?
The team is always the same. So we have prosecution, defense, therapy, treatment, probation. They're kind of the worker backbone. But then what people need is different. So you're going to bring whatever. I always say, tell me what you need and we'll try and figure it out. So you're always trying to figure out what people need day to day and month to month.
Tina, what's the Center for Alcohol and Drug Treatment's role in the DWI court?
Yeah, so we do a lot of collaborations with the treatment specialty courts and with Judge FLOERKE, but specific to the DWI court, we have a licensed alcohol and drug counselor who's assigned to that team, and they'll collaborate and coordinate with the other team members for that specific participant to get, the resources they need, the assessments done, any other resources that CDT can bring to the team, we do that. So
And she's understating it. They helped build this thing. They totally helped build it. Kind of the philosophy and the roots of it. They've been in from the start.
Judge, you mentioned that this is all kind of built around a sense of accountability. Talk about that. What's expected of the people who participate? What kinds of rules do they have to follow?
Yeah. So we do this for kind of high-risk, high-need folks. These are felons. These are people who really are struggling. And everybody's like, well, why don't you do it for everybody? Well, you check in with your probation officer daily. You take random tests all the time. You might be at inpatient treatment for 30 or 40 days. You're certainly going to be an intensive outpatient for weeks and weeks and weeks. You see me every week. It's a super intense accountability with the idea that compliance is good for us to get started. And we can kind of hold you sober and to treatment, make sure you make treatment, but then you back off so that the sobriety at first is enforced through accountability. But the only way this really works long term is if it becomes somebody's, if it's their recovery, if it's their path, if it's their life. So it's that training wheels is a bad metaphor. It implies that these are children. They're not. But it's this idea of some support that you back off and then people go their own.
And what
long-term.
happens if people fail to follow the rules?
You keep working at it and working at it and working at it.
Do they get a second chance, a third
Well,
chance, a
we
fourth
know
chance?
that, for instance, if someone has a substance use disorder, we know you can absolutely predict that relapse is going to happen. I mean, that's true in America, that's true all over the world. So if I said to you, oh, you relapsed, goodbye, that's not understanding the disease. So you work with relapse, you keep people safe, you hold people accountable, and the idea is to keep them connected to treatment, therapy, grief, whatever it is they're working on long enough so that they have traction. That's what you're looking for.
sometimes we'll increase their level of care. If they're like in an outpatient setting, we'll have them do a residential program so they can get stabilized further and then step back down.
Yeah.
So
It's
we
all
have lots
that
of options.
handoff, right?
Yeah.
Tina, how effective is this model in terms of helping people who are struggling with addiction?
Well, from a CADT perspective, it's extremely helpful. It gives these individuals a second chance that they may not have had that opportunity, unless they were able to be a participant in the court. It provides support and accountability, and it's all done in a manner that's non-stigmatizing and in an environment where they feel like they're being heard and it's their treatment. They get to participate in the development of the treatment, so it's very helpful.
Yeah. It's not one size fits all.
No.
Tell us your story. Let's work together to figure out how to help. Yeah.
Are you seeing more people with addiction problems during the pandemic? It's such a time when people are isolated and in their homes.
Yeah, because the lack of resources in the community. Some agencies have limited hours, so the access to treatment has been reduced. I think we've seen a lot more overdose and overdose deaths this year already compared to last year. So it's having a tremendous impact on these individuals.
Yeah, like you said, isolated, lots of anxiety.
Yep.
Lots of depression, lots of people wondering what the future holds. We're kind of all,
Yeah.
Tina, your organization gave Judge FLOERKE the Gary P. Olson Visionary Award. Talk
Yes.
about that. What is the award and why was the judge honored?
Yeah. So the Visionary Award was created in 2018 by CDT's Board of Directors when Gary Olson retired. He'd been working in the field, leading the field for 40 plus years. And so this award was developed in order to continue honoring leaders in the region that work in the addiction field. And so Judge FLOERKE was given that honor a few weeks ago for many different reasons. He's a well-accomplished man, but I think primarily because of the compassion that he shows in the community, with the teams that he works with, and with every one of the participants in his court. So, yeah, he's a well-deserved recipient of the award.
I was hoping we'd run out of time.
And thoughts on receiving this award?
It's an
because
honor.
it is quite an honor.
Gary's a brilliant man who loves the work and loves the people he works with. So it's a huge honor. Really cool.
All right.
Yeah.
Well, congratulations from everybody beyond your mother.
Yeah, Hi,
Thank
Mom.
you. Thank you for coming in and talking about this important
Thanks for
program,
having
and
us.
good
It's
luck.
Good to see you.
moving
Good to be out.
Yeah.
It's good to have you here. Thank you.
Thank you.
Well, that's a wrap for this week, but you can keep up with Almanac North by following us on social media. You'll find us on Facebook, YouTube, and Twitter. Visit the WDSE website for program updates, upcoming events, and more information about the station. And download the PBS video app for on-demand viewing of your favorite programs. Thanks to our guests and to the crew here in the studio. I'm Julie Zenner. Have a great weekend. We'll see you next time.